All right, hey, welcome back. This is Dr. Mark, and we just finished up Colleen's third day of procedures, so she's finished. The last cavitations were removed. I'm here with Dr. Gerry Curatola, the man of the hour, the man who did all the procedures for Colleen. And I'm just going to ask him a couple questions and explain some things that we did today. The first question I want to ask him is to explain the importance of oral health with respect to the rest of the body and why you can't just look at your mouth as far as brushing and flossing. It can really impact the rest of the body. So tell us a little bit about how that.
Yeah, no, thanks, Mark.
Yeah.
The fact is that you can have a healthy body without a healthy mouth. So you can try to detox, you can try and do, clean up your brain. Your mouth is grand central and ground zero, rather, for the health of the entire body. So your mouth is a portal for disease throughout the body, and it's also a mirror. Believe it or not, about 3/4 of diseases have manifestations in the mouth. So everything from Alzheimer's disease, stroke, heart attack, diabetes, premature low-weight babies, preeclampsia, pancreatic cancer, all of this, right down to the colon. So from your top of your head to your colon has links to oral disease. Matter of fact, the number one bacterium that's found in colorectal tumors is Fusobacterium nucleatum, and that is the most common bacteria in the mouth. So the health of your mouth is very intricately connected to the health of the whole body.
And so I was able to sit in on this last procedure and watch him perform the cavitation removal. So tell us about the couple things that we worked on with Colleen, the amalgam removals and the cavitations. I think a lot of people have never heard of a cavitation. They've heard of a cavity, so don't get the two confused. They're very, very different. This is one of the less than a handful of people in the country who does this kind of work, and this is the godfather of cavitation removals we have right here. This is why we're in New York. So people were asking us, why are you going to New York for this? Well, there's hardly anybody that does this kind of specialty work, and we wanted the best of the best, and that's why we're seeing Dr. Gerry. It's also a little hint as to the name of our channel is called The Good Doctors. One of the 3 reasons we called it that is because we're going to be bringing information and interviews to you from the good doctors, the ones who are doing the best work out there. But just tell them a little bit about amalgams and why they're so bad, and the cavitations and what you find when you get into those.
Those are excellent questions. Dental amalgams, which are commonly called silver fillings, are actually 52% mercury. They're not silver, they're mercury. As a matter of fact, they're only 26% silver, 52% mercury. So dentists are really misrepresenting, fraudulent misrepresentation if they call it a silver filling. Hey Mark, what would you rather have? Hey Mark, I'm just going to put this little silver filling that's in the back, you don't see it, or hey Mark, I'm going to stick this mercury in the back of your head.
Can I have 2?
Yeah. So the fact is that mercury fillings leach out, the mercury leaches into your body. There's a vapor, drinking hot liquids, grinding, you're releasing mercury. Now, most of us have the ability to eliminate heavy metals. Most of us have the ability to chelate up to a certain bioburden.
Yeah.
But there are about 14 to 16% of the population that have a gene variation of the ApoE4 gene, and these people can't chelate.
Yeah.
So this metal stay in.
Or if you don't methylate.
If you don't methylate, right?
Yeah.
If you're right, and so these processes, which are important for cleaning junk out, these people are really sitting ducks, and the drain is clogged, and that's where you guys come in with lots of cleanup in the gut to open up downstream pathways and things like that.
This is why the detox protocols that we use are so important.
Absolutely.
To safely remove this, but also just getting the amalgams out. You have to go to the right dentist who does safe removal practices.
Exactly.
And you see a lot of the fallout from that when you.
Yeah, patients. I was on the Dr. Oz show, I don't know, about 8 years ago or so, and we were talking about toxic fillings, and we did a whole segment on the safe removal of dental mercury from the mouth and what safe alternative restorative materials there were. And they cut that whole segment out. So instead they had
course.
Dental amalgam's bad. They do off-gas. They even demonstrated and measured the mercury off of filling.
For how long?
I talked about
For how long?
for how long does it off-gas?
Yeah.
Oh, for your whole life.
The life of the tooth.
Life of the tooth.
Yeah.
You continue to off-gas. But anyway, we demonstrated all that, so everybody ran to their dentist, who they love, to get their mercury fillings out. And there's about 99% of dentists do not use a safe removal protocol.
Can't just
so
drill
make
them
sure
out,
you
people.
ask your dentist if he understands the SMART protocol, safe mercury amalgam removal technique. Ask him if he's smart.
And how much mercury did you find in Colleen?
Lots.
So you had a lot of cleanup.
Lots. It was ubiquitous. Dental amalgam, dentists loved it. Why did dentists like using amalgam? It's easy to use. A monkey could put a mercury filling in with a thumb. As a matter of fact, there were dentists years ago that they didn't even wear gloves. They put this stuff in with their thumbs. You see a thumbprint in the filling, And the fact is, it stays in your head for a lifetime, and that's not a good thing. The dental insurance companies like it because it stays in your head for a lifetime, and they don't have to replace it. However, they are mercury, and it is toxic. But let's talk about cavitations.
Yeah.
Because you brought that up, and I think this is good. I think we can. Hi everyone, we were talking about cavitations, and we were talking about Colleen's cavitations, and Colleen has on the bottom here a very large, you can see bone, and then this here. It's really important that a biologic dentist who's trained in reading these scans, which I'm going to be teaching a course in reading this, and I'd even like to teach functional medicine doctors and chiropractors and non-dental people how to read this for their patients so they know that it's there, because believe it or not, many dentists don't even know what a cavitation is. So let me explain that. A cavitation is a slang term, and it was coined by actually an orthopedic surgeon in 1931. He found these dead areas of bone in the human jaw, and it was like a hole in the jaw, and he goes, oh, well, if it's a cavity is a hole in a tooth, then we'll call it a cavitation.
There you go.
So it's really a slang term. Even a cavity is dental caries. A cavitational stands for, we call it cavitational osteonecrosis or jaw osteonecrosis. What's the significance of these, and how do they affect your health? Number one, these are literally caves where we have all kinds of pathogens can reside. So we have cultured Lyme spirochetes, candida, mold, parasites, lots of parasites, as well as staph bacteria, strep bacteria, some very virulent anaerobic bacteria can harbor here. But most notoriously now, with the epidemic of Lyme disease, we see a lot of Lyme spirochetes in here.
So when Dr. Gerry gets in and accesses these cavitations, they take samples so that they can test to find out what pathogens are there, so you can even further get very specific with how you take care of that or treat that.
It often answers a lot of questions for people who have had all kinds of unexplained illnesses. And the third molar area is energetically connected to the pericardium and the small intestines. Here, people with gut issues, and and people with arrhythmias and things like that. That sometimes you have a connection energetically between these areas of disease and what may be going on in the rest of the body. But the important thing about a cavitation is that it is a source of chronic low-grade inflammation. And that's what people need to understand, is that inflammation is like a silent alarm bell, like gum disease is a chronic low-grade inflammation. It's like a silent alarm bell. It doesn't hurt.
Yeah, and these areas are almost impossible for your body to clean out on their own, right?
Right.
It's in a bony
Yeah,
case.
well, what happens is often the most common place is what Colleen has. This is the most common cavitation.
So
your third molars, your wisdom teeth are extracted, and the dentist puts a piece of gauze there and says, okay, Colleen, bite on this, and when the bleeding stops, watch what you eat for a few days, stay on a soft diet, and that's it.
it'll form a scab and heal. And
Right, so you get a blood clot and this and that. The problem is that the bone many times
will start to heal and stop, and that happens for a number of reasons. There may be ligaments left in this area. This is what it looks like here. You can come in closer, and even here, here's a view from the top. That's really clear because you can see bone here and then boop, right there. And in the 3D scan, I'll show you here. Take a look.
Pretty cool.
And so we can actually look 3D. Like for example, here is an area where there isn't such great bone. Good bone, not so great bone. And the interesting part about this is that the bone, when you take the tooth out, will start to heal and stop. And then there's a small amount of bone that grows over the top. The gums, the gum tissue, soft tissue closes. You get a little bit of healing bone, but you end up with something like this, folks.
Creates that perfect environment.
Yeah, it's a petri dish for
Totally.
It's warm, it's dark, it's moist. Perfect place for
Moist.
pathogens. Moist.
Best word.
Yeah, perfect place for pathogens to heal. It's very moist. The only thing that should be moist is your pound cake. I'll tell you.
So, all right. So Colleen had 4 cavitations. A couple of them pretty large. Today we're both pretty deep. Very interesting for me to be able to observe and watch this. But she's all good now. Amalgam's out. Cavitations removed. She's going to heal up nice.
Yeah.
And
I just want to talk about the laser.
oh yeah, this was cool.
The laser.
Very cool.
This laser here, if I can move this laser has 3 settings that we use in a protocol for cavitations. This is the water laser, and over there in the other corner is the Photona Lightwalker laser. They have a wavelength of light in the erbium range. Erbium, this is erbium chromium yag. And the thing about the erbium range wavelength is that it does something really remarkable. Mm-hmm. We're able to atraumatically access the lesion by reflecting the gum tissue and using the laser on the top. It opens the cavitation without having to use a dental drill or any other traumatic instrument.
So it's going through the bone, atraumatically.
And then the second thing it does is it debrides the area with ozonated water. So it generates ozonated water, and then we have a radial firing tip that fires the laser. It's like a diamond tip that fires the laser in every direction to kill pathogens in these lesions. And then the third thing it does, which is the most exciting, that's been discovered with the erbium wavelength, is that it stimulates mitotic division of the osteoblast. So it actually will help regenerate the bone, and that's what we want to do. We want to regenerate the bone.
Access, kill, and then get some regrowth going with no heat, no friction.
Exactly.
It's pretty cool stuff.
And then we use PRF from the arm, and we use some bone mineral to create a scaffold. This is not...
That was wicked cool.
That does not stay there. We create a scaffold for now your bone cells that make bone, called the osteoblast, to make new bone, and then the cells that take bone away, the osteoclast, take away the graft, and you're left with only your body's bone. So that's about it. That's cavitation.
So, and I can't stress enough how important evaluating yourself for cavitations are, and then if they're present, you've got to have an expert like this guy here who has literally pioneered the best techniques and how to do this in the best way possible for the patient. He's had to redo a lot of cavitation surgeries for people who've had them done before that just didn't take and weren't done well. But this is really an exciting new era in dental care, but it's also a lot of people have never heard of it. A lot of dentists don't even know about this or know how to do this kind of stuff. But it's critically important because of what it can do to destroying your health and your livelihood. So it's really, really important stuff. And we're going to do a lot more videos on this kind of stuff. But I wanted to at least introduce you to the man, and let him just describe to you kind of some of the procedures we did with Colleen, and so that she had a lot of work done these last 3 days, but it's all worth it. My turn's coming up later this
Your
year,
turn's coming up.
so she'll get to see New York, and I'll be stuck up in a hotel room.
Yeah, that's great, and I appreciate you doing this, Mark. And we need to bring the wall down between medicine and dentistry, and so really understanding treating the whole patient is biologic dentistry, functional medicine. It's very important to bring them together. The principles of biologic medicine and biologic dentistry is an extension of that, is that we believe the body has this amazing divine ability to self-regulate and heal. And that ability to self-regulate and heal is when we eliminate what are called the 3 T's. And actually it's Dr. Bruce Lipton who talked about this. The 3 T's: toxicity, trauma, and thought patterns. I have patients sometimes that I'm treating, and I stop because I really think they have a block, they have a psycho-emotional block that they don't believe they're going to get better.
Gotta stop
And if you don't
stinking thinking.
believe, it doesn't happen.
Right? No stinking thinking.
Stinking thinking. Exactly.
All right, so appreciate Dr. Gerry taking time to do this quick interview. So we'll follow up with some more. Colleen's got some healing to do next couple days, and then back to Michigan. So appreciate it all tuning in, and until next time, see you.